Welcome to the WPMN podcast, Professor Mirnezami. It's going to be a great opportunity for people not only who are applying to medicine, but also who are already in the system, F1s, core trainees, registrars. So if we could start a little bit about yourself and your career progression to surgery and colorectal surgery per se.
Great. Thank you very much for the invitation, Sid, and it's nice to be here. So what can I tell you? I trained in the University of Southampton as a medical student, and then spent a number of years as a junior doctor in surgery in the Wessex region of the UK, and had fellowship experience in Leeds and abroad. I also, very early on in my career, did a period of time as an anatomy demonstrator, which was a well-trodden path in the past for people who wanted to go down a surgical route to gain experience of anatomy, because that's the key building block for what we do. And so, yes, I guess mostly I've had surgical training, bar the anatomy demonstrating time that I had and the time that I spent in the emergency department as well, all of whom were useful and just gave good skills and built up more experience.
Right. Okay. A little bit more in detail about your life as a surgeon, career progression from F1, and your very busy schedule, as I know. Could you go a bit into that as much as you can?
Yeah, sure. It's quite a big question, though. It's busy, really busy, and it stays busy. It's hectic. It can at times be all-consuming, but it's important not to let it do so if at all possible. You asked about career progression, and career progression is definitely challenging and highly competitive, and you have to be good at communicating with patients and colleagues. You have to be dexterous at the operating. You've got to be knowledgeable with the clinical information. And certainly as a professor, you also have two additional hats that you wear that need to be considered. One, where you try to conduct high-quality research, and two, where you try and teach and develop the next generation, undergraduate and postgraduate levels. So when you take all this into account, it can feel like a tremendously responsible post, and I certainly feel that pressure often. Responsible to patients, to academic colleagues and clinical colleagues, to the NHS, the university, and to undergraduate and postgraduate trainees. But it can also be, and this is, the important bit really, it can be very rewarding. The other thing to bear in mind, it's never dull. And you get to work with some amazing individuals who typically share your moral compass, and you get to play with some pretty cool toys also when you're operating. It can be quite fun. Regarding the career progression, again, I think, and the early career years, they can be very difficult and testing, without a doubt. But you need to be on it and dedicated and hardworking. The hours can be hard, without a doubt. Unfortunately, people don't just get sick in office hours. And so on calls and out of hours can be busy, and for some people can be very difficult. It does, of course, depend on the specialty you do, and there can be a world of difference between the on-calls in certain surgical fields, but also between surgical subspecialties. So it's important to bear all of those in mind when you're choosing what type of career to go down as a surgeon.
Have you found any sort of tips and tricks that you could share with us, possibly, that, help you manage the stress and manage a good work-life balance?
It's difficult, again, because the work can become all-consuming. But I think having lots of wonderful time with family and good friends, having good colleagues, being and feeling part of a wider team and feeling what you do is worthwhile, and fitting in as much fun as you can is important. And I think the other tip, I'd say, generally a positive and optimistic approach to life and outlook, I think is a useful skill to try and foster as much as possible. And finally, fabulous music. You just got to have loads of good music.
Yeah, I've attended a few of your surgeries, and it does have some great music. That moves me on to my next point. What was your first ever surgery, and how did you feel?
So actually, the very first time I participated in an operation is the one that really stands out in my mind. and it was an appendicectomy I assisted in, and I was only a third-year medical student. At the time, that was not at all uncommon, and I was the first assistant in that operation. And I will always remember it because up until then, I'd actually considered neurosurgery as a potential career choice and a special module in it, but I hadn't really enjoyed it or been able to participate. So when I got to assist in this appendicectomy, and I managed to put some skin sutures in, I saw the insides, I handled the bowel as a first assistant, I was totally hooked, especially because I'd actually clerked the patient when they came in and they were poorly, and then was involved in the operation with my own hands, and then was able to see the surgeon who operated on them. It wasn't a consultant actually at the time, it was just a registrar. Then discharged the patient a few days later, feeling much better. That to me was quite a revelation, and it was quite eye-opening. And after that, I was fairly hooked on general surgery. That's how it sort of started for me.
Yeah. But speaking of surgeries, because of the pandemic, we've had so much backlog in the NHS. I don't want to say so much because these are only things I've heard from consultants and registrars and other doctors. But in your specialty, how much is currently the backlog, and how can we, ever catch up to it?
So I principally operate on complicated cancers now. And in my field, certainly, there is a significant backlog without a doubt, and it will take us all time. It's different across the different surgical specialties because I've got obviously knowledge about what's happening in other fields of surgery. But we are making a dent in it, without a doubt, but it's going to take time. And the numbers will decline depending on priority. And unfortunately, that does mean that we have to prioritize certain conditions over other conditions. And in a way, my patients are fortunate or unfortunate because of the nature of their disease with it being cancer, that they tend to get prioritized over and above conditions which aren't so life-threatening. But yes, there is a significant backlog across all of the surgical specialties, and it will remain there for a significant time. But we're going to make a dent in it.
Yeah, and I mean, on to the point of, you said that sort of working on the weekends and operating on unsociable hours, emergencies. As a junior, or even now, do you ever feel overworked and underpaid in any way? Or not now, just when you were younger in any way? Did you ever feel that way?
So yes, I guess overworked without a doubt. Certainly when I was a junior surgeon, it wasn't at all uncommon to work a 1 in 4 on-call rota with internal cover, which could translate to 1 in 3 or sometimes more. And so working 120-hour weeks wasn't at all unheard of. And that was fairly brutal at times. But there were positives to that, in that you really gained a lot of experience from times like that. And you came away feeling like you'd really understood a job, and you'd come across lots and lots of patients and lots of clinical situations, and gained and learned a lot from each of those occasions. So you leave each job like that with a lot of extra wisdom. But it could, of course, be quite tiring. And after a week like that, you really felt like you earned your rest for a day.
Yeah, of course. And I mean, you did say 120 hours. I have not heard of those kind of hours in medical school. Do you think it's a risk to patient safety in any way?
Yeah. So it was after those sort of times that a lot of legislation has come into place, and the working week and the working hours have been significantly limited. And as I said, there are pros and cons to that. The pros are, yes, potentially people are safer, but the cons do mean that surgeons potentially come out at the other end less experienced if we were keeping the same model as before. Provided we can optimize the training situation and the training environment for the junior surgeons now, actually that reduction in time doesn't need to be as detrimental and they can still come out with having had a not too dissimilar experience in terms of skill sets.
Yeah, and so you do think that, like, in terms of gaining enough competencies, enough skills to progress in your career, the amount of time we're doing now is okay for doctors, and after the legislation has sort of come out, and are we getting enough practice? That's my question, really.
Well, that's a difficult question, because without a doubt it's less than before, but enough, that depends on the individual and what their skill sets are as a baseline, and what they need to develop them to be. And it'll vary from different person to different person, but I would say actually there's no substitution for experience, and the more time a surgeon has in theatre operating and exposure to senior surgeons and seeing how they operate and learning skills, it is an apprenticeship without a doubt. I think the more time we have like that, the better. So I think you can't substitute the amount of time spent operating.
Yeah, absolutely. I agree with you. I was also going to ask you, at the start of the pandemic, you sort of told me that you had to sort of be ventilator trained. And this was at the very first peak of the pandemic. Did you help out in intensive treatment unit? How much was the sort of learning curve, and who was helping out, and what was the rota like during those stressful times?
So it was quite different for everybody, and we did have to have lots of extra training in how to manage patients that we weren't accustomed to, and everyone had to take on lots of different roles. Trained in intensive care, and I spent a short shift there, but actually the majority of the time I spent doing emergency operating and cancer operating. We were operating across lots of different sites. In hospitals we might not necessarily be accustomed to, and I'm speaking as our group broadly. So yes, it was definitely different, but actually it was quite rewarding, because it showed how when you come together as a team, you can pretty much cope with most things. And if your team is very supportive, and if you have excellent leadership, which we did, then I think it makes it manageable. And luckily we've all come through it now.
Yeah. And was this sort of in the first as well as the second and the third, that we do our third wave? But was it the same sort of thing?
Absolutely. But if anything, I think the intensity was greater between the first and the second wave. Yeah.
What do you think is the main sort of modifiable risk factor or modifiable lifestyle factors that we could change to, prevent cancer, or at least reduce our chances of getting cancer?
It's a good question. Very good question. And I think this is an important message to everybody out there, really. There are several modifiable risk factors that we can all influence. Exercise, or lack of it, is a key activity, if you like. And the more active we are, the more exercise we do, without a doubt, the better that is. And the less active we are, the worse that is, through mechanisms we don't necessarily fully understand or appreciate. Diet definitely makes a big contribution. So certainly for the cancer type that I deal with, which is colorectal cancer, diet low in fruit and vegetables or high in processed and red meats is definitely bad. So dietary modification is another absolutely key thing. Obesity is another factor which can hugely influence cancer risk. Smoking, alcohol intake, those are, I think, the real big hitters in my opinion. But if we're talking about, I guess, all cancer types, then another important modifiable risk we should mention, particularly at this time of year at the moment, is sunlight exposure and sun. So for skin cancer, obviously. So those would be, I think, the main modifiable risks that I can think of off the top of my head. But there may be others, but to me, are the big hitters.
Yeah. So if I may ask, have you ever sort of participated in any studies that looked into these modifiable risk factors, which makes you so sort of strongly so strongly opinionated about them? I know you're right, because Cancer Research UK, and there's been massive amount of funding and research into this, but have you ever sort of been one-on-one involved in studies like this?
No, actually, not because I would be against them, but because I've just not been able to participate in them. So
yeah, of course. That was a question from me. I was very curious about that. Again, another question, just general, not really just for specifically the medical field per se, but this more for like a political question, if you may. So with the new COVID vaccine obviously coming out, Pfizer, AstraZeneca, sort of flights have been trying to make this vaccine a legal requirement for flying, and the fact that even it was a discussion was very shocking to me, because there's no legal requirement for other vaccines, and if there was a legal requirement to get the COVID vaccine, do you think other vaccinations would follow?
So I'm not an expert either in politics or vaccinations, but I'll give it my best shot and my personal opinion. So I don't think we can make it a legal requirement nationally, but I don't see why it can't be a requirement for international travel. Whether that's the right thing or not, that's a different matter. But I can see situations where people are going to make it a legal requirement for that. And without having such a thing, that you might not be allowed to travel to certain areas of the globe. That, in a way, already happens with some vaccinations that we're strongly advised to have. So I think it's a small step to go there.
Yeah, absolutely. Just wanted to know your thoughts on that as a practicing doctor. I wanted to ask you, sort of, the reason we do this podcast is to sort of, entice the young minds to apply to medicine, to consider it as a profession. Do you have any tips to do well in medical school interviews and sort of, I wouldn't want to use the word ace, but sort of survive the medical school interview?
Medical school interviews. So, okay. Yes, I think be enthusiastic, be energetic, answer the questions, make sure you provide good answers to the question exactly that's being asked. Try to draw upon your own personal experiences as a student and as a human and as someone who's participated in been living for however long. And draw upon those to answer some of those questions if at all possible. Be well read, so know the sort of things that are topical in current medical practice, in current politics, and what are the current dilemmas. Think about the ethics of different situations, and again, be able to try to be practiced at being able to describe the pros and cons of a particular different ethical dilemma or ethical argument, and then also to be able to present your own opinion on something. I think that those would be my top tips.
And moving on to the next question, I wanted to ask, because I'm going into the foundation program now very soon in August, and is there anything that you think the foundation doctors these days are sort of lacking in their first few days, that you would think this is a core medical, this is something that you should have known, like some mistakes like that you wouldn't want to see happen?
No, I don't think that's a significant issue in terms of things that they don't generally know. It's more that I think I'd like to see them get more stuck into the management of patients and have more time spent with consultants, whether that's on ward rounds or in clinics or in theatre, and not just managing the day-to-day running of the ward, for example, and organising tests and results. Those are all very, very important, but actually being able to spend time in the actual specialty that they're in is a thing. And we don't often see our foundation program junior doctors come to theatre, and that's a real shame, I think. For me, that was a time when I spent a lot of time in theatre and I learned a lot, and it helped facilitate me wanting to become a surgeon. I would obviously apply whatever field one wants to go into.
Mm-hmm. Yeah, I 100% agree with you. And I think you told me this a year ago that I should try to build up my surgical portfolio as soon as I can and try to get into theatres and just suture patients, practice that, because then when I do that, the surgeon will have more faith in me the next time, and then I can do a bit more, and I can also be ready for the consultant exams and things like that, which will be very helpful. Yeah. And lastly, I wanted to ask you that you were mentioning that you do sort of a lot of research. What is the process of when you're applying for funding with a hospital or with any sort of investors? What is the process how do you approach them, and how do you sort of ace that interview, that panel interview?
Okay. So again, I think that's the process of applying for funding and research grants is complex. It's an extremely competitive process. And depending on grants also can be very time consuming. If you think a surgical career is challenging and competitive, then academia and applying for grants can be just as hard, if not harder sometimes, I would say. I've personally applied for dozens and dozens and had funding in the millions in total, but it is definitely a really tough process, and there have been many times that I've found myself on the wrong end of a committee and had my proposals rejected. In general, I think the larger the grant, the more work it needs and the more preparation it needs. There's never any substitution for having an adequate length of time and an adequate period of preparation for a grant application. A key thing, though, to probably realize, which might not be clear early on, is that most grants and research projects these days are multidisciplinary. And you need a team to do things, and having a good individual applying for the grant, having a good team doing the research into an area of important unmet need in a good institution or a collaboration of good institutions is a really strong formula for success. I've definitely certainly been rejected, but again, each time I think you also learn something about the process, and learning to cope with rejection and moving forwards, I think, is an important lesson for all of us. Because I think very, very few scientists or academics would have a 100% track record of grant applications. And dusting yourself off after an unsuccessful application ahead again with another or a similar one is challenging, but one that we need to do.
Right. Okay. Well, seems like I've run out of questions now. So that should be our time. Well, thank you very much for coming to our podcast and sharing all your experiences and all your knowledge with us. And we hope to have you back again.
Thanks very much for the opportunity.
Thanks.
Bye.
Bye.